Good. Good morning. Welcome to the Intelligent Automation News Podcast, where we explore the latest trends, innovations, and success stories in the world of intelligent automation. Today, we have the privilege of being joined by the powerhouse team at Banner Health, one of the largest healthcare organizations in the U.S. Ultimately, this team is leading the charge in transforming healthcare through automation. I'm very thrilled to introduce Susie, Shannon, and Kim. Together, this trio is at the forefront of deploying some really cool cutting edge automation technologies that streamline Banner Health's operations, reduce costs, and ultimately enhances their patient care. Definitely be sure to check out the last podcast, which is on whichever podcast platform that you use, and of course the YouTube channel. This episode is definitely going to be interesting, and I'm very excited and privileged to be able to listen to your guys' story and look forward to it.
All right. Thanks, Jesse. We would definitely appreciate having the invite to come and present to you guys. So I'm Susie Dack. I am one of the senior IT directors here at Banner. One of the areas that I have oversight within is the intelligent automation team. And what Shannon and Kim and I are going to do today is kind of give you a little bit of our journey within the intelligent automation space and where Banner is today and the things that we've implemented to hopefully help you guys out with your automation journeys as well. So, and just so you guys know, we're pretty informal, so please do not hesitate to put any questions inside of the chat. Jesse, if you'll kind of keep an eye on those and interrupt us, and we're more than happy to just stop our presentation and answer those as we go. So just so you guys know the history of Banner, we've got approximately 6 states that we are in. As Jesse said, we are one of the largest employers within the state of Arizona. We have around 36 hospitals. We run around 3 different corporate offices within Banner. We also have about 50 urgent care facilities and about 487 ambulatory clinics. And I can tell you that these statistics have probably changed because these were reported out in 2023. We are constantly expanding in various spaces, so it's probably even larger than what we have displayed here. Our DE&I for Banner, we're pretty proud of our culture inside of Banner. We've got probably over 13 IT staff within our environment, 10% of which are veterans. We are spread out across as many states as possible. Although we are based in Arizona, our corporate offices, and the 3 of us work for the corporate offices, we are actually physically located in Colorado, escaping the heat a little bit, if you will. So anyways, we have a large spread of team members across the United States. And it's really great that we can do that because, as you know, the diversity of our staff is super important. And we're able to do that through where we're present in the United States. I did look up before I got on this presentation. We've got about 61% of our staff in IT that are over 5 years employed at Banner. And I can guarantee to you the 3 of us are for sure hitting that marker. In fact, Shannon is probably our newest, and she's been here 11 years. So the 3 of us are within that 40% of 10-year plus employment at Banner. Intelligent automation is fairly new into the industry, and I would say within the last 5 to 6 years. And it'll be, as we go through our presentation, you'll be able to hear and see how we've kind of progressed and how we kind of fell into this area, if you will. We have a significant spread of generations within Banner. We are also extremely invested in promoting some of I say kids because they are kids in my mind. We have an IT intern program, and that intern program actually is for college students. Over last year, we are starting to bring in high school students that work for us for anywhere from 3 to 4 months. And believe it or not, we have had our college interns turn into full-time employees, and we have had our high school interns turn into college interns. And our whole goal with that is really, educate back into the community, if you will, so that we can also raise them up in Banner. And we call it bannerizing them, but it's one thing to learn the skill set and the tools. It's another thing to learn the organization. And that really helps when we can bring them in early on in our progress. Banner, of course, with us being 10 plus years here at Banner, you can bet money that Banner is one of the best places to work at. And we have received this award, the Computer World Award, for the best places to work within IT. Probably the last, I'm going to say 3 to 4 years we've received this. We have a lot of flexibility. We all work remotely, and it's really a great organization to work for. A little bit about our program. These are a little bit of our bragging rights, if you will. In 2022, we won a Customer Service Excellence Award with Blue Prism. Obviously, Blue Prism is our RPA vendor of choice. We also have some other tools inside of our space that we'll talk a little bit about in the future here. But one of the other things that I would say to organizations is you really celebrate your awards and your achievements, and it also gets the word out to the organization, the operational spaces, which is, you want to feed your intelligent automation space with projects. One of the areas that we have been extremely successful in, and Shannon's going to talk a little bit about this for you guys, is our developers. And as you can see, in 2022, we had a nomination for Developer of the Year. In 2023 and 2024, we actually won the award. We've had several developers, obviously, who have been nominated and awarded this. And it really just speaks to the depth of the knowledge that our team has. And they embrace this technology and they really are moving it forward. So we're super pleased about that. Some of the internal awards that we have won is, we have this middle one here that's the Banner Health Information Technology one with a little, I don't even know, a little character on it. That was our 100th bot build. We hit that about mid last year. I can tell you that we are already, as of today, up to 166 bots. So since mid last year to now, we have continued to expand our capabilities and our processes. Another award that we won was in 2023, we won a Banner Amazement Award for one of the bots that we actually built. And we'll go a little bit further into some of these processes. Kim's going to do a couple of demos for you guys later in the presentation. I won't spend too much time on this slide because as all of you who are already in this space, you already understand the benefits of what the program can provide to your organization, resolving issues, reducing human error, gains in efficiencies. All of those areas are certainly areas that we focus on in order to be successful. The tools that we actually have inside of our intelligent automation space today, obviously we have the RPA side of things. We are also a heavy hitter in our IDP space, intelligent document processing. And I believe in one of the demos, we will be talking a little bit more about that with you guys. But we are starting to do and have been doing deep learning and natural language processing with the PDF documents that are coming into Banner. And I realize that everybody says that, healthcare should be electronic, but let's be honest, there's still a lot of paper behind us. And in order to get that into our electronic medical record systems, this is how we are doing some of that work. We just actually signed a contract to bring in Chorus BPM, which is a product of SS&C's through Blue Prism. And this is an orchestration tool that we're going to be utilizing with all of our RDP, or RPA and IDP in the background. We are super excited about standing this up. We are going to be working on that over the next several months. So that's going to be our next, we think it will be one of our next big projects. We also leverage a lot of the Microsoft Power Platform space. We have citizen developers, and Kim, correct me if I'm wrong, but I want to say that Seth said he had probably around 600 citizen developers with inside of Banner today. And those citizen developers are really learning how to utilize that tool. This is not something that we want to take over from our citizen developers and manage it. We really just want to give them the tools that they need in order to do their job more efficiently, and we provide that education to them. Our intelligent automation team is so busy right now that we have not even had time to dabble in this a whole lot. So what we did was we decided that this is a tool we already have. We want to be successful with it. So what we did was we handed it over to our process engineering team here at Banner, and they are utilizing it. And the win with that is that, number one, it's getting utilized. But number two is that if they find an actual project that they know that they can bring automation into, then that's what they're doing, is they're finding it and they're bringing it back to us, and we are filling our backlog with those projects. So it's kind of a feeder into us, if you will. But again, process mining is something that we could be a little bit more successful at. We just haven't dabbled in it a whole lot. I'm going to hand it over to Shannon to kind of go through the nuts and bolts of our organization and operations, and we'll have Kim do some demos for us later in this presentation. Take it away, Shannon.
Thank you, Susie. Hi, my name is Shannon Todd. I'm a senior manager in the DevOps space in the intelligent automation team. I've been with Banner for 11 years now, And yeah, like Susie said, last year we had a milestone of creating our 100th bot. We brought automation into Banner in 2021, so not that long ago, and started out with just Susie and I as kind of a two-man team. Our team has grown excessively and it is needed. So I just want to talk to you about some of the components of our team. Starting with intelligent automation, we have a governance. With that governance team, the projects that have gone through kind of what I would say like a score sheet and are deemed bot worthy, then they come in front of a committee and we talk about the resources that are required on a high level. We talk about the applications that are going to be used just to see if there's any initial red flags or to get approval by the committee so we can continue with our moving forward with our bot build. For our growth strategy, we're very much focused on scalability and reusability of our code and anything that we can do to make our resources streamlined so those bots can run across multiple resources without having to specialize those resources for every single bot. With 100 bots, you can see that would get very time consuming and hard to manage. As far as security and compliance, we just try to use credential managing. We encrypt our passwords, so you can't ever get into a bot to read passwords. And we just make sure that the compliance is there too through that governance committee. The prioritization of projects, yes.
Sorry to interrupt. There's a question from Jen. How do you control access and manage licenses with all the citizen development?
Susie, I think that goes back to your initial citizen development presentation. Do you want to talk about that one?
Yeah, so we teach them, within our Power Platform space is what I'm assuming you're probably referencing. Is that correct? I just want to make sure. Okay, great. So within our Power Platform space, we give them their own sandbox, if you will, and we grant them access. What we try not to do is if they're needing they get a certain level, and I apologize because I'm not as familiar with this than another product owner of ours is, but there's certain levels within Microsoft of access that you can obtain. We give them a specific level so that they have the freedom to do what they need to do. If they have to go to another level where there's some licensing that's actually incurred in that, then they bring that back to our Center of Excellence and we talk them through that. We do have specific parameters though within our operations that says if they build something as a citizen developer that is patient impactful, if they build something as a citizen developer that is financially impactful to Banner, with building within Power Platform, it's for that specific user and that user manages it. Well, what we don't want to do is we don't want that user to build something that might have patient that's can be impactful to the patient or the finances or risk, compliance, anything like that. So then what we ask them to do is you can build it, but bring that back to our Center of Excellence. And what we will do is we will manage it at a larger level, an enterprise level. And that's really how we try to control that is we do a lot of teaching and education to them. And so, if they were to leave the organization and they built something, it could break and nobody can fix it. So anything that touches patients, finances, risk, those hot areas, we want them to build it, but bring it back to us to manage. Does that help, Jen? Oh, you're asking me questions that are probably a little bit out of my element, but I'm going to take that question and I can answer that for you. Does that work? Thank you. All right. And Jen, I can even connect you with that product owner of ours, and he can talk you through a lot of those various areas as well. All right, Shannon, back to you.
Thank you, Susie. Thinking about the prioritization, again, kind of just what you said, Susie, that goes first off patient care and then risk. Those are going to have the highest priorities. And as far as operations has been a huge asset to our entire team. We did not have an operations department when we started. So the developers were trying to manage the bot build, where the bot was going to run, the resources, the scheduling. Since then, operations has come in. They've helped us with managing all of that, especially the scheduling and swarming resources. When I say swarming, that kind of means like putting all of the VMs together. So that goes back to what I was saying is trying to have that scalability where we can run bots on 1 or 10 or 100 VMs. So operations has been huge. They also help us with our deployments. So we have a systematic approach to that and so thorough with their bots. they had the ability to move them into production, and that worked for us when we were a very small shop. But as we've grown, that is no longer sustainable. So operations now has a systematic approach for us, and I'll talk a little bit more about that as we go, but they have a systematic approach for us to deploy into production. With Power Platform, the education, the development support, and the development service, we're working to provide citizen developers with the training that they need to make use of Power Platform in their day-to-day operations within their own business unit. The innovation is creating new ways for the Power Platform to be used within Banner and connecting Power Platform to other technologies to make the jobs easier. Knowledge sharing goes back to what Susie was saying. It's just important that we have documentation and that we have knowledge about what's being deployed and how to support that ongoing. Next slide, please. Thank you. Our project phases. So it begins with planning. With the planning, that typically starts with a ticket that would be submitted from the business into our team's, we use ServiceNow, into our team's ticketing system. From there, the BA would meet our business analyst, gather some details about the automation, and then score that automation. Scoring would be, is this bot, the amount of resources that we need to build the bot, is it going to be far less than what the bot is going to recoup for us? So if that is successful, we go on and we start to define what that bot does. In the defining stage, the business analyst will work with the business to gather all the details, and they'll map out what we call a blueprint. It's pretty much like a glorified Visio, and it maps out the entire workflow of what a bot will do. So all of the yes, no questions, and then also if the bot can't work something, how those exceptions are going to be handled. So that begins the define as just that blueprint. After that, we have the design, which again is handed off, that blueprint and the documentation handed off to the developer. The developer begins with the build and test, a very iterative phase. We build it, we test it against what we expect the outcomes to be, and then we go back to the business analyst and the business and show them the outcomes, continue to tweak the bot until we get to a point where we think we've covered as much as we can while we're working. The bot is solid without failure, and we move into a UAT phase. After the business has accepted the results of the bot, we go into that deployment phase. And again, that is very structured, where we have a formal meeting with the BAs, the ops team, the developer. And at that point, we work through moving that bot into production, making sure that all the documentation has been completed, that the SLAs and the paperwork have been signed off of, that there's a change management awareness about that going into production. So that is how we deploy our bots. Oh, I wanted to speak really quickly about hypercare. So after we deploy a bot, we go into a period called hypercare, typically lasts about 2 weeks. And this is where the developers and the business are working very closely together to watch the output of the bot and monitor those results. In this phase, we are able to tweak in production if needed, make minor changes to that bot. I guess what I want to really mention is there is an end to hypercare. So at that end point, we've now formalized that, where then we have to sync our environments between development and production. We have to make sure that the communication then changes a little bit, that the business isn't coming directly to the developers, so that they're putting in the ticketing needed. So if there's an incident or an enhancement, they're not just in a Teams channel or IM or email pinging that developer to help them, that it gets a little bit more formal. So we try to cut down that communication once we move out of that hypercare phase. All right, team structure. Again, the business submits a ticket. So this is looking at the business analysts and consultants. At that point, the business analyst will pick up that ticket and start to assess the process with the business, learning all the details of it. They'll score that to make sure that our return on investment is going to be significant for the cost of development and resources that are going to go into building that bot. The requirements gathering phase begins, the design phase, mapping that out, like I said, through that glorified Visio diagram, which is really helpful for the developers. Once we get that diagram, we can start to build immediately. We get approval from the customers so that they understand what we're trying to capture. Not all of our bots work at 100%, which is very high to obtain. So that the customers understand what is the expected outcome from the bot? They get approval for that, and we begin the design phase. I want to jump over to development then. That's when we start to look at that blueprint and ask questions. You might have the business analyst go back to the business to get more information, and then the development begins. We begin to test our access, make sure we have the resources lined up, and test within our department. Exception handling is a huge part of our build. So we really try to make sure that anything that the bot can't work has a good reason behind it and a good explanation back to the business on why it could not be worked, and that they have their information on how to pick up these exceptions and work them manually. And then we also create a playbook when we're done with the build. And a playbook is like documentation about where it's going to run, what time it's going to run, what the bot does in general, the access required, the applications that are touched. So the playbook is just the Bible for that bot. Then we hand it off to ops for that deployment process. They get the handoff from the devs, and the deployment process begins. At that time, we have a meeting where the playbook is audited, that we make sure that we understand the playbook, the developers, and operations. We manage expectations. And then we begin to monitor the process, and we'll help operations. The developers will help operations manage those break fixes and also add that documentation into the playbook. So next time this happens, we know what to do to recover this break fix. Operations can be our tier 1 support. If they are unable to fix it, they can pass it back to the developer for further investigation, but it's really helpful that they have some information on those smaller break fix issues and that they can move that forward for us.
Hey, Shannon, there's a question whether the blueprint document and the playbook are an internal document or whether they can be shared.
I believe we have some templates. Susie, I think we would be able to share the templates.
Yep, we sure can.
Okay. I will figure out after this call who to email those to, but we can definitely share out this template. So on the orchestrate, we're just using ops to get a big picture of what we're going to be developing, and to, again, it goes into maximizing our licenses. So we have that scalability across our resources, and they also have swarming. And I don't mean to keep going back to that word, but it's very important. So swarming is having a pool of resources that a single bot can run on. So instead of having a bot with one resource and waiting for that resource to free up, we have a bot that could run on 1 to 15 resources. So it really helps with our licensing and our timing of completing jobs. So we have a couple different measurements. The first measurement that we're doing really well at capturing is how long we are saving, or how much we are saving. So we have individual items that the bot works. Typically, we can put a time to those items. So for instance, if a bot works an item and it takes 2 minutes, that would be something that the business would come back to the BA and say, it takes us 2 minutes to open up this application, look up this patient, do XYZ, close the chart, whatever that process might be. Maybe that's 2 minutes long. And then we can calculate, the bot worked 1,000 items today, that's 2,000 minutes saved. So we're really good at capturing those stats and measuring that. The next set of measurement that we're moving on to is KPIs. So that's going to be looking more at, the bot used to run in 30 minutes, now it's running in 45. What happened? So we're kind of getting into that scalability. Again, I already talked about that, kind of going back to having a pool of resources, not just one for one. And then cost reduction. Yeah, we're always looking for savings. So how do we get from development to deployment faster? Looking for those cost savings. How do we better utilize our licenses? How do we better troubleshoot to get bots that break up and running faster? Next slide, please. Thank you. So Power Platform, currently there's over 5,000 Power Platform flows, incorporating over 600 makers. In Banner alone, we're saving 71,000 hours with the deployments that have been made throughout Banner. So if you think of an average FTE, about 2,000 hours, this is a huge time savings for Banner. This is my teammate's area in Power Platform, but he is just really starting to expand those capabilities into the citizen developers and have that support throughout the organization and education so that each individual business unit has the opportunity to use Power Platform to enhance their operations.
And just to add to that too, Shannon, so Seth, who manages this portion of our program within Intelligent Automation, he really does have a whole entire educational session that he teaches throughout the organization. In addition to that, he's got a lot of the governance and the COE built around this. And it would be like a whole entire different presentation just to talk about the Power Platform space. So we're just going to brush over this to know that this is a piece of Banner's Intelligent Automation program. But it's a pretty big lift in order to bring this into an organization and run it efficiently. He's done a really amazing job with it.
Okay, and our lessons learned, start with those simple processes. So start with that low-hanging fruit. I'm not sure that we followed our own advice on this one, but it was a lesson learned. So, take a simple process and try to tackle that one first. Establishing development templates. So within Blue Prism, we have templates for populating a work queue for a main process workflow. This helps in a couple ways. It really helps springboard our development getting started. So a lot of the common pieces, 30% of it's already there. And we just have to start using that template to really build in the specifics. Another great thing about using the template is regardless if I develop a bot or one of our other developers, it all has the same look and feel. And that makes it so much easier to troubleshoot. Again, standardizing those playbooks, just having the same commonality so that each one has the same sections, the resources are listed out, it's just like having a template for the playbook, just making sure that they are very similar so that they're really useful in troubleshooting. And then consistent runtime resources, again, that goes back to swarming, making sure that each of your resources are not built for a specific bot, but they're more available to run 1 to 100 different bot workflows because your bots were built, without being so application and environment specific. So just having consistent runtime resources. Right now we have, I think it's called an OU, where we basically can order up a VM, a resource, and it's just like putting a map on it. We don't have to worry about specialization software, building it from scratch. It's just I'm trying to think of the word, Susie, an image. That's what I'm trying to say, an image that goes onto our resources. So very, very common. Isolate VMs for updates. This is super important. Try to get away from your organization pushing updates to your VMs. This often has caused us problems where we might get an Microsoft Edge update that could break our bots. So try to get out of having automatic pushes and rather have 1 or 2 VMs that get that push, and then you can test your bots against it and make code changes before it actually affects your production environment. Identify those applications that are heavy hitters and try to train your staff on those. So those are the ones that you're really going to want to have the best playbooks on so you can get those back up and running the fastest. Versatile operations staff, man, we have that. We have so much knowledge in our operations staff, and making those connections across Banner into different departments, super, super important to build those relationships and build that trust. And the way you build that trust is being consistent in your documentation, your deployment strategy. Just make sure that you have staff that's versatile and making good friendships throughout your organization, managing enhancements and break fixes. If you have an application that's running within your organization that you have a bot touching, try to get in front of the vendor if it's external, and make sure that you get information of the updates that are coming and that you can isolate that to 1 or 2 VMs and do that testing before it gets pushed out.
Excellent.
Thank you.
Thanks, Shannon. So I'm going to add one other item to our lessons learned here, just so, and my team hears me say this all the time. We at Banner take the approach that you don't just build a bot to build a bot. We build in a very thoughtful way. And the way that we do that is we want our core systems, like our EMR systems, our ERP systems, our HR systems. We want all of those applications to function as they should. So if somebody comes to us and asks for a project to be built, our first question is, what core system does it touch? Can that system do it? And if they can't do it, that's when intelligent automation steps in. So we fill a void is really what we do. We do not build to just build. We fill a void so that we are utilizing our resources, and everything that Shannon just spoke about, we're utilizing our resources more efficiently. So that's just something to be very thoughtful of, especially if you have a lot of consulting firms that are coming into your organization. I have learned in the past that they like to build, and that's just not thoughtful for the organization as a whole. So that was another lesson learned that I think we probably identified pretty early on. So I'm gonna, for the sake of time, I'm gonna go into strategy just a little bit, but I want to make sure that we get a couple of the demos that Kim has available to you guys. So bear with me as I go through this pretty quickly. But if you do have any questions beyond this, please do not hesitate to reach out to us. We're more than happy to answer any questions. A little bit of our growth, or growing our intelligent automation department inside of Banner. These are some of our heavy areas that we kind of really brought forward through the organization. We've been very fortunate to have senior leadership support. We were granted a capital budget, which doesn't happen very often, of like 1.5 million for just a year. And we're about a year and a half into it, and we're still utilizing it because we haven't gone through the whole entire budget yet. But those were for specific projects that we built and brought to fruition. What we did was we built and brought them to fruition, but we also had funding left over because we were so efficient with it that now we are utilizing that capital funding for other projects inside of the organization. A lot of things that we do is continuously ongoing education for our teams in the operations spaces and in IT. If people don't understand what intelligent automation means and the tools that you have, you will not be successful. So there's continuous education to those that are out in the operational spaces so that we can teach them and educate them. Kim has a automation champion program that she stood up, and that's exactly what that does. Educate those individuals so that they can learn about it, so that they can feed your backlog with projects. Don't be afraid to promote your program. I mean, we publish all of our bots, and I will show you them in a minute. We publish them in a CIO weekly. Every single time we bring a bot to deployment, we actually publish that so that people, number one, can see what we've done, the work that we've done. And it's with the birth announcements, which is an item here on the list. We also make sure that our customers that we worked with are recognized for those bot builds, because we want to make sure that, celebrate this. We've done some great things. Let's celebrate them. So get your customers involved in it, and they actually really, really appreciate it. We do a lot of collaboration across Banner. I cannot tell you how many departments we touch, how many people we've met, how many people we know. That is massive in order to make a successful intelligent automation department. This is just some statistics in reference to our bot builds. I certainly am not going to go into all these details. Things that we record are how many birth announcements we send, because we send a birth announcement for every new bot build, how many hours we've saved, the records that we've touched, because sometimes you're not saving hours, you're just touching records, or return on investment. And again, don't get too caught up in these dollar amounts, because some years we have heavy hitters and some years we maybe don't. And that's okay. It just depends on what you've built the bot for. And is that bot a long-term bot, or is that bot just an immediate need because of risk or compliance or something like that? Shannon's built within her template that anytime a bot runs, the statistics go into a SQL database. And that database is what we actually use to calculate all of these. So every single time that bot runs, we are in a real time on our return on investment. And that's been really huge for the promotion of our department. These are just some of the bots that we've built. These are what we would call birth announcements. This is what they look like when they go up to the Banner public, if you will. And they just describe, like, we name them, we give them creative names with our customers. We tell them exactly what they do. And then we also just announce, like, what's the date of birth, all this kind of stuff. These have been probably one of our most marketable areas. We get a lot of attention to these. In fact, we get a lot of people that say, hey, why don't, I haven't seen any birth announcements lately. What's going on? Or, oh my gosh, you guys published 3 more birth announcements. So these draw a lot of attention to the organization, which is great. So Kim, I want to save you a little time, and I apologize. We kind of went through a few of these, but you want to start your demos a little bit, and I'll try to keep up with as you're going through the slides.
Okay. Good morning. My name is Kim Anderson. I am the IT product owner on the Intelligent Automation team. I've been with Banner for just over 18 years and on the Intelligent Automation team for 5. I'm going to talk about 2 of our automations that we are pretty proud of and also that have a pretty good ROI. The first one I'm going to be talking about is named Imaging Flexi. Imaging Flexi will read incoming imaging order faxes and extract key data elements. It then generates an HL7 that is ingested into Banner's imaging system. This data is available and already in the system when a patient calls to schedule their appointment. So very high level of what this process is going to do. Faxes are put into a network folder, and then they're going to go to Abby Vantage, our IDP system for processing. And Vantage, once it gets the file, it's going to check the format and make sure it matches one of our 5 custom layouts. If it does, it's going to extract certain data points, and then it's going to pass this information on to Blue Prism for processing. Blue Prism is our RPA system. Blue Prism from there is going to create an HL7 for ingestion into Fuji, which is our imaging application. Fuji will then receive the data points, and it's going to move the document into an archive folder. The clinic at that point in time will work any exceptions. Next slide. What we're looking at here is this is the network folder where all the faxes are dropped. WriteFax is our application that works our faxes, so it's going to put it into this folder. Our automation is going to scan this folder every 5 minutes, and it's going to take these PDF files and it's going to move it to a different folder. And next slide, Susie. Yes, processing. So it's going to move all of those faxes into this processing folder. We want to get them out of the first folder since all these faxes are coming in, and we want to put them in this folder so that when our automation runs, it's not picking up these documents more than once. Next slide. Okay, so when our automation looks at the document, again, it's going to look and see if it's one of our 5 custom layouts. And if it is, it's going to search for these 27 key fields. So we have some that are required and some that are optional. So the fields that are required are the patient name, date of birth, gender, phone number, provider name, NPI, order date, the priority, the diagnostic name, and the assessment. Now, the optional fields that we'd still like but are optional, nice to have, are the patient's address information, the clinic address information, and any kind of insurance information. Now, what we're looking at here is actually within our Abby Vantage system. So here it has the document on the left, and then on the right, you can see this is where it's pulling those data points. And once it has those data points, here's what the HL7 looks like that it will put together for ingestion into Fuji. So this is in the Fuji system. And again, we're just pointing out the areas of the data points, such as name, gender, date of birth, stat, priority, the assessment. This information is all the insurance information. And then finally, we have provider name, provider address, diagnostic name, NPI, that sort of information. Now that it's done doing that, it is going to take that fax and it's going to move it into the archive folder because the process is complete. At that point in time, there's another system that's going to go and do a robocall out to the patients, tell them that they received the orders for their imaging order, and to go ahead and give them a call to make an appointment. So all that information is already in there. Here's the exceptions folder. So if we do have a document that does not match our 5 custom layouts, it's going to move that to the exception folder for human intervention. As Susie mentioned, we are currently working on deep learning, so we're hoping to decrease those exceptions in the future. A couple fun facts on this automation is that we process about 300 to 400 of these a day. And it used to take the clinic staff 4 minutes per order to do that. So we are saving them quite a bit of time. Okay, our next one is named Rosie the Referaler. Rosie will read incoming faxes to identify if they are a referral. She will enter the referral into Cerner EMR and upload those documents for approval into the patient's medical record. The documents will go into a network folder. Vantage will come in and extract the name, the date of birth, the urgency, and then pass this on to Blue Prism for processing. Blue Prism will then go into Cerner and add the referral into Ambulatory Referral Manager, which is like a workload, create the phone encounter if necessary, and then upload the document into WQM, which is our work queue monitor for approval and to be attached to the patient's chart. From there, the clinic will actually review that document and then approve it. And then similar to the other process, it's going to pick up those referrals, move it into a processing folder, and then it will actually rename it by adding a timestamp to the name at the end. So the 3 tasks that's going to take place here is the referral is going to be added to the Ambulatory Referral Manager tool, the work list. It's going to create a phone encounter in Cerner if it's needed. And then it will add the referral to the work queue monitor to be included in the patient's chart. So here's just a couple of screenshots of what that looks like. So here's the work list, and you can see the items are listed here. And then if you double click that, you can see that a note is actually added to that item that says the bot placed that there, and then it actually puts another timestamp in there. And then here it is in the work queue monitor, getting ready to add it to the patient's chart. And if you can see here that you have the referral on the right. And so the clinic will come in here, or the end user will come in here. It will look at the name on the referral. It'll double check it to the name up in the blue banner at the top. And if it all matches, which it should, they're going to go ahead on the left and hit complete. And then it removes it off the work list and then just puts it in the patient's chart. I think we're at like 17,000, and it would take the staff between 10 to 20 minutes to work these items.
Thank you, Kim, for going through those. Yeah, as you guys can see, our return on investment with some of those that we've combined our IDP and RPA with, they're pretty substantial. And that's really honestly where a lot of our projects are coming from at this point in time. We are starting to add a little, we're venturing into a little bit of the artificial intelligence, Gen AI spaces, but we're certainly continuing to expand our IDP as well. Jesse, I think that's all for us. I apologize, we've been a little bit over time, but hopefully you guys got enough out of this today, and we're more than happy to pass the information along to you as well.
There is a couple of questions. Daniel was interested in whether you're using an application platform for dashboarding. And secondly, if you're giving the end users or the business areas access to that.
That is something that we have been looking at. In fact, I think, Jeff, you and I spoke about this almost a year ago. We do have a dashboard for all of our KPIs for the performance of intelligent automation. With the business process management tool coming in, we are looking at some of those work lists, and that's what we would like to do with this. Maybe put up the exceptions for our staff to work them directly from BPM, but we have not expanded that far. So it's definitely an area that we can improve upon.
Great. And then Safari was interested in if you guys have MFA enforced for your service accounts.
Shannon, I'm going to leave that one into you.
The next one is Jen was interested if you use Blue Prism to extract the data from the image faxes.
We use from the image faxes, it's actually Abby Vantage is our application of choice in that space. However, we do also do document automation that is a Blue Prism SS&C product, and that we utilize for handwriting. So we are extracting handwritten documents with prior authorizations today.
Jen was interested, are the faxes all the same format? And then secondly, does Abby require a lot of training?
They're not the same format by any means, no. Which is also why, you know, Shannon's team does templates. We isolate like what are the largest formats that come in, and we try to grab those and program for those first, and then the exceptions would be those miscellaneous formats, if you will. It takes a lot of training. We can tell you that we did training with insurance cards. So we actually extract data from insurance cards to download it into our EMR system. But it does take a lot of training. It takes a lot of time, but I think it's well worth it in the end, if you will. But to try to capture, like for prior authorizations, they're not all the same format. For referrals, it could be, hundreds of different formats. You will never capture all of them.
And
And
SKUs.
Susie, oh,
And yeah, there's so many
I
different.
just wanted to mention with those markups, with the training, we are just now hiring this week a high school intern to assist with those. So pretty excited about that.
Daniel's interested.
Yeah, decided not to go that direction. Yeah.
Patrick was asking, he heard 17,000 and 30,000 referrals. Was it 17,000 in August and 30K today since the automation was built?
It was 30,000 for the month of August, and then to date, from September to today, it's been 17,000.
Great. And then Catherine was interested.
We have Abby's product of Timeline inside of our ecosystem. We have handed that off to our process engineering team. And the reason why is because our team in intelligent automation honestly just doesn't have time to do the work. As you guys know, and this is one thing that I would love to get any insight on, we're a heavily fragmented environment. So we have an EMR system, we have an ERP system, we have an HR system, we have a billing system, you name it, we have all these systems. Well, if you really want to do the full process from start to finish, you almost need to connect the dots between all of these systems. And that has been a challenge that I, in the intelligent automation space, didn't want to venture into. So we handed this tool off to our process engineering team. And the goal would be is that they can utilize this tool. And then when they find those pockets of automation, they bring them back to us and then we program for them. So we would rather them feed it to us than us to be the ones that are data mining it.
Great. All right, Nourish, we're gonna cut this off in about 2 minutes here. Is there human in the loop when using Abby?
We do actually have one process, I think, right, Kim, that there's human in the loop on.
Yeah, there is human in the loop on the imaging Flexi process that I was talking about. They did go into Abby and look at areas where Abby might have flagged it as not being able to read it. So yes.
And the beauty of that is that then that trains back into our Abby Vantage system so that learning can continue to happen and our end users are doing it for us and we're not having to do that learning inside of intelligent automation. So it's a partnership.
Great. We've got a question from EO with regard to learning or training the bot on handwritten documents.
So I don't know if I would say training the bot on it. I would say that, we went through, I don't know, a Pepsi challenge, if you will, between a couple of different document automation tools to see who can read handwriting best. And when we did this about 2 or 3 years ago, document automation, the SS&C product actually came out way ahead of even Abby Vantage, which we already have as well. So we decided to purchase that specifically for that reason. We don't really do any training with it. It's at a pretty high percentage of accuracy already. So we just keep utilizing it the way it is.
Pretam's interested in the team ratio in your IA team, whether it's split between support and development.
Are we talking about business analysts as well that design the process, or are we talking about operational people that are maintaining the bots once they go live?
I think both, I would presume.
Okay.
Is that correct, Pretam? I'll let him chat, but we can continue.
So we have 2 operations folks, and that's all they do is once it goes to production, they work with Shannon's team and they maintain the bots and make sure that they are running efficiently every single day. We have Shannon, 1, 2, 3, 4, 6 developers, and then 7 including you.
That's correct.
Yeah, and we have 3 consultants of those 6 that have come in through a consulting firm for us so that we can flex our staff in the development space. We have Kim on the business analyst side. We have 2 product owners and 6 business analysts that actually design out our processes.
Great. Okay, we're going to cut this off. I want to just send out a huge thanks to Susie, Shannon, and Kim for sharing their experience and shedding some light into their transform automation journey. For those that are interested in kind of digging deeper on this topic, check out the website, subscribe to the YouTube, and check out the podcast on whatever podcasting tool you use. Thanks so much for listening, and we'll see you next time. We've got another interesting speaker coming on October the 10th. It's Catherine Stewart from Novalis. They're going to walk through current processes, smart improvements, maintaining efficiency, And so it's really about improving the business processes and providing basically a practical guide for automation leaders. So that'll be on October the 10th, and look forward to seeing you all there. Thanks so much.
Thank you. Bye.